Dr. Keith Hansen is a doctor from Sanford Fertility and Reproductive Medicine, and he talks about the starting point for a couple thinking about getting pregnant. One of the first things Dr. Hansen likes to do is an optional screening to check their family and genetic history.
We just have to collect a specimen, either saliva or blood, send it in, and then they can test it and tell us if they carry cystic fibrosis, spinal muscular atrophy, or any of these other really serious genetic illnesses. And then we can talk to them about the illness, explain how we can help them, to avoid that illness.
After that, Dr. Hansen likes to help the couple enhance their health before getting pregnant, whether that be managing diabetes or changing medication to not harm the baby.
The better health that a person is in before they get pregnant, the less likely they are to have complications during their pregnancy. We also like to evaluate them to see if they have an underlying medical issue that needs to be, treated or optimized before they become pregnant.
Another thing Dr. Hansen likes to check with adults is checking with their recent immunizations and see if they're up to date.
Because it's really important for a woman and her husband too to be up to date on all their immunizations, because we've come a long way in medicine to be able to treat our patients with vaccinations that have reduced the risk of getting some serious illnesses during pregnancy, which can be devastating to the mother and devastating to the baby.
Once all that is checked out, the woman must stop whatever birth control they use, and Dr. Hansen says once periods return, couples should be ready to start trying for a pregnancy.
And as soon as you start having regular periods, as soon as you start ovulating, which usually is, regular periods are usually a sign of ovulation, then they could start trying to get pregnant.
Dr. Hansen says the prime time for trying to get pregnant is roughly 6 days, with the last day being ovulation.
The best time to get pregnant is within that 6-day window. The pregnancy rate really drops outside of that time period.
Dr. Hansen does bring up that as a woman ages, it will be harder for a couple to get pregnant.
As a woman grows older, her chances of getting pregnant reduce because of, the ovaries start to not work as well, and there's an increased risk of chromosomal anomalies, which increases the risk of miscarriages.